Microneedling creates something that is genuinely hard to achieve any other way: direct access to the dermis for topical ingredients. Most skincare products, even expensive ones, do not make it past the stratum corneum in any meaningful quantity. Your skin evolved to keep things out. Microneedling temporarily defeats that barrier. The window is short, roughly 30 to 60 minutes. What you choose to do with it matters. The stratum corneum is the outermost layer of the epidermis. It is dense, tightly packed, and lipid-rich, essentially a biological waterproof membrane. It does its job well. The molecules in many beneficial skincare actives are too large or too hydrophilic to cross it in meaningful amounts under normal conditions. When microneedling creates microchannels, it provides a direct bypass route. Large molecules like certain hyaluronic acid fragments, growth factor complexes, and peptide chains can now access the living dermis. Absorption can increase by orders of magnitude compared to standard topical application. Hyaluronic acid is the most forgiving and universally appropriate post-needling ingredient. It is a humectant. It draws water into the tissue, and it is soothing rather than stimulating. Apply it immediately after your session. Vitamin C, as L-ascorbic acid or a stable derivative, is a powerful antioxidant that also directly participates in collagen synthesis. Post-needling delivery significantly enhances its effectiveness for both anti-aging and pigmentation goals. Peptides are short-chain amino acid sequences that act as signaling molecules. Different peptides instruct fibroblasts to produce more collagen. Others signal skin tightening responses. Others inhibit muscle contraction similar to botulinum toxin. The challenge with peptides topically is that they struggle to penetrate intact skin. Through microchannels, their bioavailability improves substantially. Growth factors and growth hormone peptides represent the frontier of post-needling serums. Epidermal growth factor, EGF, keratinocyte growth factor, KGF, insulin-like growth factor, IGF-1, and platelet-derived growth factor, PDGF, are among the most studied. These molecules directly trigger cellular repair, proliferation, and regeneration. In professional settings, platelet-rich plasma, concentrated from the patient's own blood, is sometimes applied immediately after microneedling for maximum growth factor delivery. At home, topical growth factor serums offer a practical alternative. Exosomes are an emerging category worth watching. These are extracellular vesicles, tiny packets released by cells to communicate with neighboring cells. They carry proteins, RNA, and signaling molecules. When applied post-needling, they may amplify the regenerative response. Research is still developing, but early results are promising. Minoxidil, applied to the scalp after needling for hair loss protocols, penetrates far more effectively through needled scalp tissue. Be aware, most minoxidil formulations contain alcohol, which will sting on freshly needled skin. Some practitioners wait 30 to 60 minutes post-needling before applying minoxidil to allow the most acute sensitivity to pass while the channels are still open. Retinoids, retinol, retinaldehyde, tretinoin are not appropriate immediately post-needling. Their enhanced penetration through open channels significantly increases the risk of irritation, peeling, and inflammation. Hold retinoids for at least 24 to 48 hours after your session. Chemical exfoliants, AHAs like glycolic and lactic acid, BHAs like salicylic acid, are similarly contraindicated. The skin is already in a state of controlled injury. Acid belongs nowhere near it. Alcohol-based toners, essences, or products, they will burn and they introduce unnecessary irritation. Makeup. Skip it for the day. You are creating openings in the skin barrier. The last thing you want is to introduce cosmetic ingredients, pigments, or preservatives into the dermis. Chemical sunscreens. If you go outside post-treatment, use a physical mineral sunscreen containing zinc oxide or titanium dioxide. Chemical UV filters have enhanced penetration post-needling, and you do not want them reaching the dermis. Final episode: who should not be doing this? The contraindications, the risk factors for darker skin tones, and what signs mean you need to stop and call a professional. Explore microneedling devices and serums at www.unbedsidemanners.com.